Welcome back to Cancer Buzz. I'm Summer Johnson. Cancer Buzz is reporting this week from the ACCC 39th Annual National Oncology Conference. Our next guest is Wendy Waugh. She's the Administrative Director of Cancer Services and Ambulatory Infusion at Southern Ohio Medical Center. This is her fourth year as an ACCC board member, and she also serves on the Financial Advocacy Committee. Hi, Wendy. Thanks for stopping by.
Hi, Summer. I'm so excited to talk to you about these guidelines and the things we've got going on with ACCC. Good stuff.
It's good to see you and everyone in person this year.
I know.
Today we had an intense financial navigation workshop, and that's what we're talking today is about the financial guidelines. Why are the financial advocacy guidelines important for cancer programs and practices?
So, Summer, I've been serving with the Financial Advocacy Network for a little bit of time, and I remember a couple of years ago when we were on a Zoom, and we're like, we need to establish a level of professionalism for financial advocates, and how are we going to do that? And somebody in the room said, we need guidelines. We need a certification. We need certain things that these financial advocates can do and will do, and that will elevate the whole scope of what financial advocates do. So this, for me, is super exciting to see these guidelines come to life.
How do these guidelines help administrators with staff retention?
Okay, so I'm an administrator, right? But I need to have metrics, and I need to be able to make the case on how many financial advocates, counselors that you need, and exactly what is it that they need to do. So first of all, when you take a look at the guidelines, it really helps. And sometimes administrators, we don't know exactly what those steps are that the financial advocates need to do. So this is the thing that we're used to doing with Joint Commission and with many of the other certifications, accreditations that we manage. We're used to saying, do this, and then figure out how we're going to do this. This is the scope of practice that they need to do. So this lines that out, and it's just going to be huge. Now, I think also, so you're talking about retention, and so it helps you describe the role to the person who's interested in financial advocacy and helps you design an orientation around what are those key points. So you have that realistic job preview of what it is that you're going to do, and hopefully you're passionate about doing it.
What about identifying the metrics to track for ROI? What about that?
So metrics, so important, Summer. There's nothing that we do today that I think analytics and metrics don't touch. We all have a bottom line that we need to look at. We need to be able to say, we've done this with this. What did we do this month? Why didn't we do this month? And it's always changing. So you have to compare, like, do I still need to do this kind of prior auth, or am I working with insurance verification or benefits? So tracking those metrics is critically important, and it's changing from the on the phone sort of thing to all these different portals and logins. That's just so important for us to know what we can do and what we have to do.
That makes sense. How will these guidelines help programs across the U.S. deliver care to patients with cancer?
So I know the guidelines aren't officially released, but sneak peek, one of the recommendations in the guideline is that you're going to meet with the patient. And that sounds like rudimentary, but here's the thing, not everybody does. So it really is going to provide a framework for what you need to do and when you need to do it.
That's well said.
Yeah, thank you.
Last question, and I know we've talked about this off the air, but what does being part of this financial advocacy network at ACCC mean to you? What has it given to you for your own personal job growth and satisfaction and those things?
Well, I'm going to go back just a little bit to something I alluded to just a few minutes ago, and that is that my background is a healthcare administrator. I don't have the expertise of what are the things that a financial counselor, financial advocate, insurance benefits, claims, those people are experts in their own field. When I got involved in FAN, I mean, it blew my mind, Summer. Just understanding the level of detail and what needed to happen. I don't think we know that. I think we just assume that this goes this way. Now, when we have a new process, when we have something, I'm like, show me. Show me how long it's taking to fill out this online form. Show me the questions that you need to answer so that I can decide, are they clinical? What kind of staff needs to do this? And how can I separate the clinical aspects? What's the pharmacist need to do? What's the nurse need to do? What's the advocate need to do? And how do they need to collaborate? So for me, it just opened my mind to a whole science of work and established me with a network of wonderful financial counselors that I could just pick their brain. And through that, we've established such good relationships that now we're like, scratch, I don't know. Well, somebody knows. Like, we can throw it out there on the blog. We can talk to someone we know. We can send an email. We can text. So it's given me a network of people to solve problems. And that's what we need to do.
Thank you, Wendy. We'll be back right here on this channel tomorrow with more from the ACCC 39th Annual National Oncology Conference. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.